what I understand is there are so many areas in healthcare and in diagnostic which are unexplored, and of course there's a lot of investment also need to happen in those areas. One of the most important area which we believe is non-communicable disease. It's much more unexplored area, and whether it is cardiac problem, obesity, or diabetes, or diabetic foot, where we are focusing on now. The therapeutics or therapy around this will only accompany with the right diagnostic and right prognosis. What do I mean by this? Is you need to know what is the cause of this problem. So that's a diagnostic. You exactly should know that, and of course that will happen after proper screening, and also which kind of drugs or therapy will go along with this. And for example, just to give you an example of diabetic foot, you will see most of the amputation happening in the people, because if you do not detect the site of infection, the mode of infection, the cause of infection, and which drug would affect this infection, it will keep growing. It's as good as enriching the bacteria by giving the wrong drugs. So you need to detect in right time which bacteria and which drug will work on this. And in that, by just doing that, you can save lot many amputation, but also lot many lives, because we have seen that people will die early if the amputation happens. So the effective diagnostic tool and effective treatment planning tool will only accompany hand in hand. That's what we have seen in glucose with insulin. You measure your insulin glucose and you give the insulin. Same way it will go for cardiac, same way it will go for obesity, diabetic foot, infection management, AMR, or as well as same kind of therapy will go on autoimmune disorders. You will have to decide which kind of drug will accompany you. So such investment areas would be something which we are looking at. The second area is building biosensor based technology platform. It's a next generation tool. It's though too early for the world, but that's what we are believing in. How early effectively you can detect. So today the fastest testing method to detect any antigen antibody detection for infectious or non-infectious markers is around 10-15 minutes. We are talking about 30-40 second test, so that people need not to wait when they wait for the result, and they are as accurate as a lab level result. So that's the second area of solutions we are looking at. And third is the symptomatic testing. Till date we are looking at one disease or one virus or one infection agent at a time. For example, in COVID you just screen for COVID, but what if the person who's coming with the symptom might have flu, might have TB, or might have RSV or other respiratory infectious causing bacteria or virus. And for example, in fever it may be dengue, but it not necessarily may be dengue, it may be malaria, it can be chikungunya, or so on. So ideally for the doctors you need a tool where in one go you can detect all causative agent in one go, so that patient need not to pay more. Secondly, patient need not to wait much more for the result and the damage to happen. So looking at symptomatic testing rather than individualistic testing is something which we are focusing on, and that's where we will focus on our investments on.